Welcome to Better Health Together, and you'll see that I have with me the CEO of the Australian Digital Health Agency, Kelsey.
Thank you.
And digital health is, well, from my perspective at least, is a top of mind topic. We've had a big year or so on My Health Record.
Yeah.
First step, and I'd be really interested to hear from you about, well, what next?
Yeah.
What do we need to do to keep building capability? And what do you think some of the challenges are going to be in that?
Well, maybe I could just, in a way, take us back to sort of first principles. Because sometimes I think people think that digital health is about technology, which of course it isn't. It's actually about the values we all want to see in a modern, person-centred health service, one that is giving patients and citizens more control over their health and well-being, giving doctors and other clinical caregivers access to better information resources to help them make better decisions. And although Australia has one of the world's best, possibly the world's best health service, if you think of it in terms of the outcomes that patients experience, it could be still so much better. And that's the experience people have of fragmented care, delivery.
Yes.
But at its worst, that can be harmful. So we have had a number of reports over the last few years, for example, of the instance of admission into hospital because of medication misadventure. So people are taking the wrong pills, pills they may be allergic to. And roughly speaking, the current estimation is about 250,000 people are admitted into hospital each year unnecessarily for that reason and potentially put in harm's way. Now, digital health, i.e. the simple act of sharing information about those medicines so that a doctor, when prescribing medicines, knows the history of a person's medications, we think, and the evidence says, will have a tremendous impact on reducing incidence of harm to people. So digital health is really about supporting a modern health service, be much smarter about improving the quality and safety of its services and the experience patients have of those services. And I'll just give you an example. I was in the Pilbara yesterday, actually, talking to a number of frontline care workers, and perhaps most resonant was a conversation I had with the leader of an Aboriginal medical service in that part of Australia, and he was just describing the current situation. This is modern 21st century healthcare, in which people are flying from one very small remote community to a slightly larger town, then getting off that plane, getting off another plane into Perth for an appointment with an outpatient, which 9 times out of 10 could be done with telehealth services. Or, for example, somebody's been discharged from a big hospital in Perth, they're going home, they live in a remote Aboriginal community, they lose their discharge summary, and when they see a doctor subsequently, they may get the wrong medicines. So simply a doctor in that remote community having access to the My Health Record so they can see the discharge summary and any further medicines information could stop that readmission and really help that person live a different have a different opportunity. So these are real world instances in which nothing more complex than information sharing at the point of care, digitally enabled, can really make a big difference.